Welcome back, everyone. I'm Frank the Paramedic. In this video, we're going to be talking all about acetaminophen, also known as Tylenol, APAP, or Panadol. So first things first, what's acetaminophen's class? What does it do? It's an antipyretic, so it reduces fevers, and it's a non-narcotic analgesic. So it has mild to moderate pain relief effects. So acetaminophen mechanism of action. Why does it work? How does it work? Well, acetaminophen targets cholineoxygenase enzymes that produces prostaglandins that are responsible for pain and fever. So this little diagram on the side, I just found it a little while ago. It's kind of a good uh, illustration of what kind of happens with the fever and pain aspect. So it starts with injury or infection and goes all the way down to some membrane disruption, which affects the phospholipids. And then after that, it goes to the arachidonic acid. And then that starts affecting the cholineoxygenase inhibition. Sorry about that. Which then affects your prostaglandins, which then reduces your pain and fever, or increases your pain and fever. And then we give acetaminophen to reduce the fever. Acetaminophen pharmacokinetics. I cannot talk today, I apologize. So it starts working within 15 to 30 minutes. Again, with any of these medications, but this one can be given orally and rectally. So typically, orally is going to take a little bit longer, about 20 to 30 minutes, since it has to go through the whole GI system. Rectally is going to be a little bit faster, since it kind of bypasses that the acidity of the stomach. To go in the reverse direction, so there's a lot more absorption, a little bit faster. So when do we give acetaminophen? Again, this is very dependent on your local protocols. Typically, we give this to pediatric patients or children less than 12 years old. If they have a fever of greater than 102.2 degrees Fahrenheit or 39 degrees Celsius, who are conscious and alert. If they're conscious and alert, we can give it orally. Depending on your protocols, if they're out of it, not completely alert, not completely conscious, you might be able to give it rectally. It just kind of depends on your protocols. Recent seizure, if it is suspected hypothermic seizure, or hypothermia is the suspected cause of the seizure, then you can give this medication. Just make sure it's not environmental heat causes, because that's completely different pharmacology. Whereas you just want to get them out of that hot environment, which is external, rather than infection, injury, colds, sicknesses, whatever it might be, which is more of an internal cause of these higher temperatures. And then you can give it for mild, moderate pain. Again, I've seen some protocols where you don't give it for pain whatsoever. Some protocols that allow you to. Just make sure you study your own protocols. But this is kind of just a general indications of what I could find in several different protocols. So some contraindications: known liver disease, chronic alcohol abuse, which kind of goes along with liver disease, and if they have taken acetaminophen in the last 4 hours. Now, the first two, liver disease and chronic alcohol abuse, that's going to pertain more towards the adult side rather than the pediatric. And again, if you can give this for adults in your protocols, just you got to know that stuff, because acetaminophen is very hard on your liver. And if they've taken acetaminophen in the last 4 hours, you don't want to overdo it. You don't want to give them too much, of course. So another thing you got to consider, which will be in one of the next few slides where I talk about it a little bit, is that a lot of medications contain acetaminophen, even though that might not be the main reason why they're taking that medication. So you just got to make sure you get a good patient history, a good over-the-counter and prescription medications, and try to find the bottle, see if it contains any acetaminophen. So some precautions, like we just said. Make sure you consider that when you're calculating your dosage. Again, that's completely dependent on protocol if you're allowed to change the dosage if they have taken acetaminophen within the last 4 hours. Most of them that I've seen do not allow you to give it at all. Again, totally protocol dependent. Let me know in the comments below if you guys are able to give it if they've already taken acetaminophen within the last 4 hours. So I'm kind of curious. I haven't seen very many protocols that allow you to. Yeah, just let me know. Side effects, there's none in the pre-hospital setting. I haven't been able to find any acute side effects. There might be a little bit of stomach pain associated with it if they're sensitive to the medication. And your dosage, for adult and pediatrics, typically it's 15 milligrams a kilogram to a maximum of 1,000 milligrams total, orally or rectally. And again, that's really protocol dependent. I haven't seen very many protocols that aren't 15 milligrams a kilogram. I have seen it where you typically don't give it to adults and only pediatrics. Just something to consider. In your overdose management, some signs and symptoms: sweating, anorexia. I saw it in one of the protocols. I decided to put it in there. That's going to be definitely more of a long-term side effect, and that definitely, in my opinion, that shouldn't be your first thought. If they're having a acetaminophen overdose, because there's a lot of other different causes for anorexia, as well as sweating, nausea and vomiting, abdominal pain, cramping, diarrhea. There's so many different signs and symptoms that mimic this. So just get a good history if you can. Get a good medication list. So if they did overdose on acetaminophen, your go-to is going to be activated charcoal. And pretty much every protocol I've seen is you only give it within 2 hours of ingestion, or if you can get online medical controls approval to give it if it's after 2 hours. That's pretty much it, guys. Thanks for joining me on this quick acetaminophen lesson. Let me know what you guys think. If you have any questions, comments, concerns, put it in the description. If you guys' protocols are different, I'd love to know. Or if you don't agree with something I said, I love having discussions. So yeah, let me know. Like, comment, subscribe. It really helps me out. I know I'm just getting started, and I love teaching. It helps me learn, as well as hopefully it helps you guys learn as well, or at least have a review. All right, see you guys in the next one.